Hello friends, I'm Dr. Swati Kanakya, pediatric hematologist oncologist from Mumbai. 8th of May every year is marked as the International Thalassemia Day, and this year's theme is strengthening education to bridge the thalassemia care gap. This series of videos, Living with Thalassemia, is for patients and their families. We are sure that this information will help them to make informed decisions regarding their health. Every time there is an advance in the management of a disease, there is a ray of hope. And a new ray of hope is a medicine called as luspatercept, which we have been waiting for since a long time. So, what is luspatercept? You all know that in patients with thalassemia, the red blood cells get destroyed easily, leading to what is called as ineffective erythropoiesis. Luspatercept is an EMA or an erythroid maturing agent which enhances the maturation of red blood cells. This medicine has been used in patients with thalassemia major who are transfusion dependent. How does luspatercept really work, or what is the effect in a patient with thalassemia? So we just talked that luspatercept allows the red blood cells to mature, and this decreases the anemia, it decreases the need for transfusion, it decreases the need for iron chelation, and in fact some studies also suggest that it may actually help in chelation or removing the iron. The biggest question that everybody has in their mind is that is it an injection or a tablet? Well, friends, it is an injection which is available in two strengths, 25 milligrams and 75 milligrams, and it is a subcutaneous injection, a tiny one. You must have seen people taking insulin for diabetes, a very tiny injection in the skin. We generally start at a dose of 1 milligram per kg, but the maximum dose is 1.25 milligram per kg. Needless to say, although this is such a simple injection, it has to be taken under the guidance and care of your treating hematologist. So, of course, we want to know that how useful is luspatercept actually. So, when we look at any drug, doctors look at trials. These are clinical trials where the drug in question is studied and the results are then analyzed, and we decide whether or not a drug is safe, how useful is it, or what is the dose, what are the side effects, how long can it be used, etc. For luspatercept, you have to think of two trials. One is the BELIEVE trial, which studied patients with beta thalassemia major, and they found that around 11% of these patients were free from transfusions. The second trial, which is very commonly discussed, is the BEYOND trial. The BEYOND trial looked at patients with non transfusion dependent thalassemia, and they found that 77% benefited with an increase in hemoglobin by 1 gram per cent. However, for patients with non transfusion dependent thalassemia, luspatercept is yet not approved by the US FDA. In some European countries, it has been approved. Let us see what are the side effects of luspatercept. 3.6% patients had blood clot formation or thrombosis, and of course, we advise patients to look out for symptoms of blood clot formation. Patients had bone pains, muscle pains, joint pains. Some of them had dizziness or vertigo, headache, uh, GI symptoms like nausea and diarrhea, hypersensitivity reactions, abdominal pain, cough and breathing problems, and high blood pressure, for which they have to be monitored by the doctor at all times. So let us look at luspatercept in India as of today, that is April 2023. In India, luspatercept is licensed for use in adult patients with transfusion dependent thalassemia. It is also used in myelodysplastic syndromes, or MDS as we call them, that are transfusion dependent. It has been approved in 2022, and luspatercept has been marketed since March 2023. How many patients are using it in India as of now? Maybe 25 to 30. And the cost at present is 29,000 rupees for 25 milligrams and 87,000 rupees for a 75 milligram vial. The next very important question is it used in children? So, as of now, no. There are phase 2 trials going on in children between the age of 12 years to less than 18 years. This is the part A of the trial, and the second part, or the part B, will look at children between 6 years to less than 12 years. Thank you, friends, for watching this video. I hope it was useful. This video is an educational initiative by the Blood and Cancer Clinic, Kanakya Healthcare. For more information on thalassemia, watch our other videos as well. A small reminder before I sign off: this video or any of these cannot substitute the consultation with your hematologist, oncologist, or thalassemia center.